Moms always seem to put everybody and everything before themselves. The kids, the spouse, the house. It can be exhausting, but many times she forgets to look out for herself and her health. So this Mother's Day weekend, we are taking a closer look at the important preventative steps that moms should follow to make sure that she's around to continue taking care of everybody else. Joining me is Dr. Koren Weston with Seton Family of Doctors at Balcones Woods. Thank you for joining us.
Hi, thanks for having me.
Okay, let's talk about this because from the top, moms just, do you just tell a woman, hey, just slow down?
Yes, just calm down, and you can't take care of everybody else if you don't take care of yourself.
Yeah,
yes, absolutely.
Yeah, and another thing too, I think that women do also too is we hold on to things like our heart. You know, we know that heart disease affects a lot of women,
yes,
much more than men. That's another thing too. Just let it go.
Right.
You're not going to be able to get everything done. Right. So if the dishes are in the sink, right, leave them there.
Yes.
So then what are some of the things that, so once she said, okay, all right, I'm calm, what are some of the screenings that she needs to take care of?
Right, so after she takes care of the kids' dentist appointments and making sure her husband goes to the doctor and making sure everything else is taken care of, she needs to take care of herself too. So she needs to go to the doctor and get her checkup and you know, do self-breast exams, go get her mammogram, go get her checkup. There's a lot of important things that the woman needs to do. Sometimes women hear that they don't need a pap smear every year anymore, and they think that means they don't need to go get a checkup. But that's actually not true. They need to go still get their breast exam and their mammogram and their skin check, and they still need all these preventative health screens to make sure they're okay.
I'm glad you brought up the pap smear because I heard it was every 5 years, but you can actually request it every year?
Usually your insurance will still cover it every year, but you don't necessarily have to get it every single year. It's usually every 3 to 5 if you're stable, monogamous. But some women are like, oh great, that means I don't have to go anymore, but you still need to go and get your checkup and make sure you've got your vaccines and make sure you get your mammogram and make sure, you know, you get your blood work done. Sometimes women have some pre-diabetes brewing or something else that they don't know about. Their blood pressure might be going up. You know, there's different things that might be going on. That
what about heart disease? Because we talked about heart disease. What goes into that? Is that just a blood check? What?
Well, so that's sort of the whole picture of, do you have any increased risk factors? Again, do you have the high blood pressure? Are you starting to get some pre-diabetes? Do you have some high cholesterol? So it's usually blood work, and then you might not have any signs of heart disease right away. But you can do things to prevent it, especially if you've got family history of heart disease.
I know we're talking about women kind of all age ranges. Let's target that premenopausal. Where does the hormonal changes, how does that factor into it, and what should she be doing at that age, that stage?
Right, so those are, you know, premenopause, you're trying to take care of yourself, keep yourself healthy, you know, fit time in there for exercise, make sure you're eating well, try to get some, you know, good fruits and vegetables in there, not just on the fly all the time. And then make sure you're, you know, going to the doctor once a year.
And then for our moms, our grandmoms who are beyond that point, what should they be doing? Because there are moms too.
Right. So, you know, you want to take care of those people too, and they want to do the same things. They want to get to the doctor every year, make sure they're getting their screens. They still need a mammogram every year. I have women who are in their 60s and 70s. Oh, I don't have to do that every year. Yes, you do. You know, my grandma had breast cancer when she was 72. She got her mastectomy and her treatment, and she's 95 now. You want to keep them going.
All right, Dr. Koren Koren.
That's fine.
Weston. Okay. Thank you for joining us.
Sure.
And are you a mom?
I am. Yes.
Happy Mother's Day.
You too.
Thank you for leaving your family and come and join us.
Sure. Thank you very much.
All right.